I'm going to go ahead and start recording. The 2 full days now. That's wonderful. You like your site, Damien? Okay, good. All right. Well, what I want to tell you is that we are now in the process of grading comprehensive exams. Oh, I'm sure that you guys will pass once we finish reading. But so Dr. Fitzgerald is not in the office, and she went online to read, and she was freaked out because some of her things were online and some were not. So she has to finish reading when she gets back. Several of faculty are out, but they are reading. So it won't be next week, but probably the week after that when we know, because I'm leaving tonight for Georgia. I think Dr. Fitzgerald is in one day and then she leaves. Dr. Iris is jumping on a boat. So that being said, it won't be next week, but probably the week after that. Those ones that we have that have been turned in, I'll go ahead and do the final grades on. And so don't fret. I'm pretty sure that you guys will do okay. But what will happen is after we finish reading and we come up with the scores, I will turn them into the graduate school, and that will be who informs you, typically. But of course, I'll keep you informed. I'm going to family reunion, and so therefore, I will be going to Georgia this evening so that I could get to South Carolina on time tomorrow, because I am president of our family executive board. I'm president of the family reunion. So therefore, I need to be in place for registration and all that kind of stuff. So that being said, I won't be reading this weekend, but I will be reading mine on Monday. So don't fret about comps. Go about your lives. Do well in your clinical practicum. And tonight what I want to talk about is the 2017 public policy agenda. And the reason I would like to talk about this is because what happens is every year, really members of the American Speech, Language, and Hearing Association are asked to provide their input on what they feel are issues that should be high priority for advocacy. Okay, and so what happens is ASHA has a committee called the Government Relations and Public Policy Board, and this board, the charge is for it to guide the advocacy efforts that the association and its members want us to, I guess, to consider, or to really to do something about. Okay, so what ASHA likes to call this is a blueprint for, let me see. Okay, you can still hear us. So ASHA likes to call this a blueprint for action. And so what we're going to talk about is the 2017 ASHA Public Policy Agenda. And there are going to be various areas that ASHA is interested in. So for example, the areas are healthcare, and then they will cover a broad number of topics or advocate for a broad number of issues under the area of healthcare. Another area is education, and ASHA will advocate for a number of issues under education. And then we have professional issues that are important. And so there'll be various topics under the area of professional issues. And so ASHA's goal is to really try to advocate for issues that adhere to 7 foundational principles. And these principles are client care, evidence-based practice, non-discrimination, collaboration, ethics, diversity and inclusion, so forth and so on. Okay? And so what ASHA asks is that we become familiar with what these issues are, and then that we help advocate for those issues. Okay, now, can you guys still hear me? Because I'm getting all these messages about the phone failing, and I'm not on the phone, but I'm on a mic. So it says that the connection to the teleconference has failed, and so I don't know if somebody is trying to log in or what. Oh, okay. Yeah, because what's going to happen is we are going to switch over to Zoom, and but tonight we're in Blackboard Collaborate because the university has not discontinued Zoom. But I keep getting, again, these messages that somebody is trying to connect. So hopefully nothing will happen in class tonight and we will be able to get through our lecture. And then I also want to talk about praxis a little bit tonight, okay? All right, good. So these are issues that you're going to be confronted with when you graduate, because you're going to become speech-language pathologists, and you're going to be working professionals. And so as you become more involved in service delivery, some of these things are going to affect you, particularly if you are working in a facility where you need to bill people, okay? So, with that being said, at the federal level, one of the things that you need to be concerned about is Medicare reimbursement and coverage policies. And the reason for this is that when you become again, professionals, you are going to have to treat persons who are Medicare beneficiaries. And how you get reimbursed is going to be affected by changes that have occurred to the Medicare payment system. And so these changes in reimbursement and coverage are going to be affected by value-based purchasing and evidence-based practice. And what we mean by that, when we talk about value-based purchasing, is how valuable are your services? Can you show that what you are doing will have an effect on your patients, an effect that shows progress? In the case of Medicare, the system wants to know, or the Medicare organization wants to know that if they're going to pay for services, that they're going to see progress. So that's what we mean by value-based purchasing and evidence-based practice. So you've got to show that your service is valuable and that you have some evidence that your clients are going to be successful based on the type of treatment that you are providing. So ASHA is going to advocate for you to be reimbursed for your services as well as audiologists, and they're also going to advocate for coverage of your services as well as devices. And because Medicare, may or may not pay for your services. They may or may not cover like augmentative and alternative communication devices that you might recommend for a particular Medicare beneficiary. they may not even want to do hearing aids or anything like that. So we don't want to serve clients, but we do want to serve clients, but we want to get reimbursed for our services. And if Medicare won't reimburse us, or they don't give us a lot of money, or they're trying to make us share reimbursements, then we have issues with that. Okay, yeah, it doesn't pay for hearing aids, but ASHA is requiring, well, they're advocating that Medicare pay for various devices and that we be reimbursed. So what they have done is they will represent both audiologists and speech-language pathologists before the Center for Medicare and Medicaid Services. They want to make sure that the center maintains and or expands coverage, reimbursement rates, and so forth and so on. And they'll also represent us on the American Medical Association coding committees, so that we make sure that when you provide a service, that service has a particular code that is reimbursable by Medicare. Any questions about that? So, you know, basically, right now, as students, you aren't really doing any billing, but when you become a professional, you want to get reimbursed for your services. So you want to be able to work with individuals who are beneficiaries of both Medicare and Medicaid. And so that's why they're also looking at Medicaid reimbursement and coverage policies, because we know that Medicaid is important for persons in both the healthcare and the school settings if you're going to be a provider. Okay? So the same kind of issue as Medicare, changes in Medicaid reimbursement, and then that should be Medicaid, and coverage policies are going to be affected by the value of your service, like are you valuable enough for them to consider paying for the service, and then evidence-based practice showing that whatever it is that you do, that you can show that, you know, it's effective. I don't know, Brittany. I know that in some CF positions, people are not billing, and then there are some settings where people want CF people to bill. But you are you don't have your certificate of clinical competence yet, because the CF is part of your certificate of clinical competence. You got to get through the CF, and usually people that bill must have their Cs. So I don't know what the latest is on that, yet, but I'll ask around. Okay, so ASHA's going to do the same thing that they do for Medicare. They are going to advocate for coverage and adequate reimbursement of services that you provide, both in the school setting and in the healthcare settings. And then they're going to promote reimbursement for devices and subsequent rehabilitation to include but not be limited to hearing aids, which they don't currently reimburse for, cochlear implants, other implantable devices and related equipment, and AAC devices. Yeah, you know, that was a big discussion, Nicole, about billing. For people who didn't have their Cs, that they could do it under somebody else's license, but I think it's still very controversial. Okay? So I have to find out what the update is. Okay. Another issue that we're interested in is identifying we want to identify persons who need coverage very early. So we want to do early screenings, and we want to screen periodically. We want to do diagnostics, we want to do treatments, and we want to make sure that our services are provided from the very earliest of times when a child is first born, and that these services continue to be able to be supported and provided as a person ages and gets older. So what we need are appropriate policies, guidance, and regulations related to Medicaid coverage services in schools and in healthcare settings. We also want consistency as it relates to these procedures and requirements for school-based Medicaid services. So here, not only are we advocating that we receive reimbursements and so forth, but we're looking at reimbursements for people in the schools as well as in the healthcare settings, and we want to cover kids that are really young as well as people who are very old. Okay. Now we know that there's a lot of discussion right now about health care, and we know that the Republicans are trying to come up with a good health care plan and to repeal Obamacare. But right now, until it's repealed, really, you still have the Affordable Care Act in place, and that requires that everybody be insured. That requires that you be able to pay for some type of coverage that at this point may be very expensive or may be affordable depending on what company you're with. But ASHA continues to collaborate with state associations to advocate for the implementation of the Affordable Care Act and to reflect the value of member services as it relates to habilitating and rehabilitating individuals. So what we want to really make sure is that everybody who has health care insurance, first of all, that they are covered and that our services are protected under their coverage. So ASHA is going to advocate for reimbursement policies that include habilitative and rehabilitative services in private health care plans. They want to repeal or delay implementation of the Cadillac tax, and they want appropriate coverage and co-pays of audiology and SLP services, and they want enforcement of appropriate health care services. And hold on for 1 minute, guys. I need to go lock the door down the hall. I hear people coming in, but they should be in class. I'll be right back. Hold on. Okay, I'm back. Yeah. All right. Thank you so much for allowing me to go ahead and lock the door. I just feel uncomfortable sometimes in here by myself. But anyway, again, we want reimbursement for our services, be they habilitative or rehabilitative. We want that reimbursement from private health care plans. And we also, because, and the reason for that is private health care plans will vary. So my plan may be totally different than your plan, and they vary in the amount of services they will cover, or if they will cover any services. In other words, so no matter who we work with, we want to make sure that we can be reimbursed, whether they are Medicaid recipients, Medicare recipients, whether they are recipients of health care through private plans, so forth and so on. The repeal or delayed implementation of the Cadillac tax. This is a tax that is supposed to begin in 2020, in which it's a 40% tax on plans if somebody has a health care plan that exceeds, I think, $10,800, or if you have individuals in a family of $29,000 something dollars, it has to be paid by the insurers. And so we don't want the type of coverage you have, the amount of coverage that a person has, cause them to have to pay a 40% excise tax. So that's what the Cadillac tax is, and that's just outrageous. So of course we want that repealed. And we want to ensure that health care plans, whether they be private or otherwise, would cover or pay for co-pays for audiology and SLP services. Yeah, that is nuts. Isn't that nuts? And then, of course, we want the enforcement of appropriate health care benefits. So these are things that ASHA actually goes up on the Hill and they advocate for. That's what we write our senators and so forth. ASHA gives us talking points at these conferences that you go to, and particularly the Tennessee Association of Audiologists and Speech-Language Pathologists. What happens is that they will have an advocacy table, and they'll have letters already written, and they'll ask you to sign them, and they'll send them to your representative, you know, helping us. That's right. That's what you're going to be doing, Sophia, up there fighting, fighting, fighting. And when I was a legislative counselor for the state of South Carolina, you would go to ASHA conferences, but you didn't attend the conference. You were in meetings, the whole conference. And then we would go to visit our senators and our representatives, you know, from our states. And then we would go and talk about talking points that ASHA would give us. So it's, and then of course, you know, some organizations have a lobbyist, and they're there to help us get legislation through or to help us advocate, okay? All right. So again, when we look at private health plan reimbursement and coverage policies, these private health companies, are really these private health care plans, have increasing restrictions that demand demonstration of the same thing, value of member services, because they don't want to pay for things that are not appropriate, and they don't want to pay for services if they can't see that the service has any value or the person improves. So therefore, ASHA is going to advocate for appropriate reimbursement and coverage. Okay, so let's see. And we also want not only reimbursement, guys, but we want appropriate reimbursement rates. So ASHA will advocate for coverage and adequate reimbursement for services and devices provided by speech-language pathologists and audiologists, and they will also provide input to coverage policies and private health care plans, and they will also advocate for the consumer and providers, so for both the persons who are receiving the services as well as the providers, which are you, through the appeals process. They're going to advocate with private health plan providers and insurance commissioners to help change coverage rates and to make sure that you are allowed to provide appropriate and adequate services and get adequately reimbursed for those services. Okay. So those are the kind of health care. Well, there's some of them. We're going to go back and talk about so we talked about Medicaid reimbursement, Medicare reimbursement, the Affordable Care Act, private health plan reimbursement. So we still have to talk about a couple of other health care issues, which we'll talk about in a minute, and that's telepractice and hearing health care. But basically, when you look at all of those things we just talked about, the basic issue is that we want to be reimbursed for our services, and we also have to educate and advocate for appropriate reimbursement, because these companies only want to reimburse if they feel that your services are valuable, and they don't know what you do. And they also want evidence that once you provide the service, progress is going to be made. So they don't want to pay for a service if the person isn't going to, quote-unquote, progress. And that makes kind of sense, except for not everybody can progress to 100%. And they should cover services regardless. Okay? So now let's move on to the education issues. So a lot of you are in schools, or some of you are in the schools, and what we have are laws. You got school laws. Everybody took the school's course, I'm assuming. So we're going to look at the reauthorization of federal education legislation. All right, we have various laws that we have to function under. One is the Individuals with Disabilities Education Act, the Elementary and Secondary Education Act. This is better known as No Child Left Behind. Every Student Succeeds Act is new, and they're trying to put policies and guidelines in place for this act now. And then we have the Higher Education Act. So we want all of these federal education acts to be reauthorized, okay? So that's what ASHA is advocating for, the reauthorization of IDEA. And we want to promote the inclusion of funding, not only for speech, language, and hearing services, but also for literacy service as well as devices. Okay, we also want consistent language and common terminology for specialized instructional support personnel, including audiologists and speech-language pathologists. And the U.S. Department of Education is currently developing rules and regulations for the Every Student Succeed Act. The implementation should be now, years 2017, 2018. So in the fall 2017, 2018, we hope that this act is implemented, but they're in the process of putting rules and regulations in place. And this is the U.S. Department of Education. Now, we want to have SLPs included in the federal policies about literacy. We want to support the appropriate use of audiologists and SLPs in literacy programs and professional development initiatives, because we are language specialties and literacy revolves around language. We want there to be greater flexibility for the use of general education funds for children who are at risk but who are participating in general education. So this is your response to intervention. Okay? We want to promote the reallocation of Part B funds for IDEA so that they will align with the needs of ASHA school-based members and graduate-level academic programs. We want to seek opportunities for audiologists and SLPs to participate in or to have provisions that are provided by the Higher Education Act. And more than anything, we need to be a part of concussion management. We are not really a part of that management. Still, it's getting a little better, but we have to educate. Who better to work with someone who has a cognitive language problem as a result of a concussion? Okay. And we also want funding to practice with or to serve children who are in early intervention. Okay, so because there are all kinds of threats to early intervention services, one being the reduction of funding, the fact that it's hard to get reimbursements, the fact that other people are working within our scope of practice. And so all of these are constraints that affect us in providing early intervention services. Increased paperwork, greater caseload, workload. So all of these things are things that affect us in school as well as in early intervention. Accountability is also one of those things. So the other thing you got to realize about funding in the schools is that IDEA is supposed to provide funding, and at the initiation of IDEA, the federal government committed to cover 40% of the cost of IDEA funding, but in 2013 they had only covered 14.9%. And in 11, they reduced, or they cut education programs. They cut the funding for education programs by $1.25 billion. In 2012, it was cut by an additional $233 million. It's been cut since that. So schools really are supposed to provide part of the funding, and it's supposed to be matched or more by the federal government. But that's not happening. And I'm going to tell you something. I know it's not happening because when I worked in the school system, there were no supplies to serve these kids. And how many of you are out there working in your school systems? I know that you're working as, some of you, maybe students, or some of you may have worked as speech teachers or assistants. I had to make everything came out of my pocket because of funding cuts. I mean, it's outrageous that you can go work in a school system and you have to serve kids with disabilities, but there are not enough assessment instruments. We don't have a budget to buy tests. We don't have a budget for therapy materials. And so, I mean, there are all kinds of issues. You don't have funding for support personnel to come in and help you with these children who have disabilities. You guys, anybody know what I'm talking about? Anybody out there know what I'm talking about? Well, wait and see when you start working, okay? All right, so And we also want appropriate accountability measures, okay, because we're SLPs, so we need to be accountable. But let's say when you go to get evaluated, you're evaluated based on the standard of a teacher as opposed to that of an SLP. Now, that's how it was when I came through. And I'm like, no, I don't even do these things. That's not who I am. That's not what I do. But we need accountability. The services that we provide need to be appropriate. They need to be also, we need to have funds to be able to provide those services. So we want to oppose cuts in education funding. We want to come up with alternative kinds of ways that would help us reduce the paperwork burden and the administrative burden. And we also need to educate administrators or decision makers about our workload requirements. So, and funding that we need to serve our clients, because I don't know, but you guys have been in the schools. Most of y'all are in medical sites now. How high was your caseload? Anybody? How high was your caseload? How many kids did you have to serve? Anybody? Anybody with serve? Okay, Sophia said 55. Anybody between 75 and 80? 65, 80. Anybody have 100 kids on their caseload? Because there are school districts where that's happening. Okay, no caps in Sumner. But I'm telling you, isn't that a burden when you have that many kids? You got to serve them because it's the law. But then the federal government is cutting funds, not providing the funds, and you got to go in. How many of you had to go in and make your materials? Because I certainly did, and I'm in Williamson County. I mean, I walked in every week. Of course, now we had theme-based therapy, but I was spending gobs of money on my own stuff. And we had a test bank, so you could go borrow a test from the test bank, but I'm in a school where I'm seeing kids, and I need to have tests available. Of course, you assess every 3 years, so that in itself, might be a reason why I don't need all those tests. Yeah, it does feel impossible and pointless. Okay. Yeah, because the paperwork and the scheduling, and then you see these kids for such a short period of time anyway. And then you got to find time to get the paperwork done. So all of these things are things that ASHA want to kind of go away, and we're looking for solutions to them. ASHA also will advocate for states to adopt Part C of IDEA. And this relates to infants and family program requirements. We want SLPs and audiologists to be used in the identification and treatment of children in early intervention programs. We want to implement federal standards related to IDEA Part B and ESEA, Elementary Secondary Education Act. We want increased funding for Part C, appropriate and timely reimbursement of early intervention services. And we want SLPs and audiologists to stand on, or to be a part, or to serve on, not stand on, but to serve on diagnostic intervention and management teams related to concussions. And with kids that just have concussions in general from falls, accidents, but also with student athletes. Okay, so Sophia, tell me what your comment is about. Oh, you can talk to me if you can. You mean scheduling and paperwork, Sophia? What are you referring to? And if you're talking, I can't hear you. Still can't hear you. Yeah, but I can't hear you. Guys, could you hear anything? No. Okay, work on your mic, and I'll let you come back and comment on your your chat that you typed. But guys, let me ask this. So you see, the medical setting is so different because you have a revolving door depending on whether you are, long-term, acute care, so forth and so on. So you may see gobs of patients over a period of time, or you may see very few patients over a period of time, but the schools is a whole different animal. And so when you talk about cutting education, funds for education, that's very problematic because everybody needs to be reimbursed for their services. Everybody needs support. Everybody needs supplies and materials. Yeah, and manageable caseloads. That's right. That's right. Okay. So, all right. So we already talked about they're going to advocate for standards as it relates to, federal implementation of federal standards. So we talked about this for Part B and for ESSA. And then we talked about our role in serving on concussion teams, so being a part of diagnostics and intervention, so forth, and management. So let's move on then to hearing. Well, did you know that hearing loss is the third most prevalent chronic health condition facing seniors today? In fact, only 1 out of 5 actually have at least one hearing aid. And most elderlies, like I know when my dad got older, he really needed a hearing aid, but just refused to get one. But there are lots of people that cannot afford to get these hearing aids. So Sophia on the phone, but I've noticed that more of the medical services use their own materials. Oh, okay. Yeah. So, I mean, I know it occurs in both settings, but it's just outrageous to have to come in and, like, in a school environment and you don't have materials, or the materials you use are not enough, so, but yeah. Okay. So, we also have, so in terms of this hearing loss, people can't afford the hearing aids. Only 1 out of 5 actually wears at least one. You've got Medicare and private plans and other types of agencies that will not reimburse for hearing aids. But we all know that it's very important to be able to hear. And the problem is only 15 to 30% of those persons with hearing loss actually receive the treatment. So that's problematic. So we've got health care legislation that needs to be advocated for. It's in a greater need now because you've got all these people with hearing loss who cannot afford hearing devices, and so we need to make sure that they can afford the services, appropriate audiology and speech-language pathology services. They can afford hearing devices, and we need to increase the educational efforts. We need to increase the education of the public in terms of hearing conservation issues. So we are going to support the hearing aid tax credit legislation. This will help increase the affordability of hearing aids. And in this legislation, they get a set amount of money over a period of years to be able to buy hearing aids. And I can't remember how much it is. It might be $5,000, $2,500 each for 2 aids. But I have to go back and look, so do not quote me on that. We want to support FDA regulations and guidance documents related to Internet retail sales of hearing aids and personal sound amplification products. And the Trade Commission oversight of deceptive advertising by sellers and of these personal sound amplification products. So we don't want people to go onto the website and be able to just purchase these hearing aids or these sound amplification devices without appropriate oversight, okay? Because people will sell you anything, and you know you got to go through tests, and you got to have aids made to fit, you know, based on your needs. Yeah, Nicole, I think it's like $2,500 per aid, I believe. I think that's how I got to 5,000, but I still have to go back and look. So thank you so much. The OSHA and ANSI standards and regulations to prevent noise-induced hearing loss, we want to support that. We want it to be cost-effective. We also want to promote implementation of the early hearing detection and intervention program. So in the past, all these states have this early detection program through the newborn hearing screening, but what happened was they would screen the infants and they didn't have any type of intervention in place. So now we not only want to make sure that they are detecting when there's a problem, but that intervention is provided, and then that there's comprehensive follow-up and management. And this is across both state and federal levels. We want to adopt hearing screening standards for school-aged children, and we want insurance companies to cover hearing aids, cochlear implants, and related devices, and diagnostic and treatment services for children who have hearing problems. So this is what ASHA is going to do. They're going to advocate for audiological intervention services in the management of hearing loss. That includes hearing rehabilitation services, counseling, and dispensing of hearing aids. They want to support the USDA in terms of their regulation and guidance documents that will distinguish between hearing aids and personal sound amplification products. They want to monitor and evaluate the effect of any proposed legislation or regulations intended to change the current delivery model of hearing aids. And we also don't want any and everybody out there dispensing hearing aids. Okay, so another thing that we're interested in, because these are kinds of healthcare issues that we were talking about, but also we're talking about educational issues, and we're talking about professional issues. So this is a professional issue, the loan forgiveness as a recruitment and retention tool. Because why? Okay, we need speech-language pathologists and audiologists, but it costs to go to school. You guys know that. And so what, as an incentive to getting people to major in the profession, we want and to work in these areas where kids really need services, like these poor areas. We really want to monitor programs and encourage programs or incentives that will help forgive, in some sense, student loan. Okay, so if you forgive my student loan, then I'm going to provide services in an area where we don't have any SLPs because it's a very rural area, it's a very poor area. So we want that type of incentive in place for people to go work in those areas where services are really needed, but nobody wants to work. But if I pay off your loan, then you at least have to give back 2 years. And it's like me giving the funding for paying your tuition. You're going to go work in a school as a speech-language pathologist because we need SLPs. So we only want you to take the funding if you can do the service agreement. So it's kind of like the same thing. We already talked about Medicaid reimbursement and coverage policies. States are seeking ways to reduce the financial burden of Medicaid because the problems we're having in terms of serving these kids is that we need reimbursement rates. We need we need to be reimbursed adequately. When we serve kids and or adults who are on Medicaid, and we already talked about this, it increases your caseload, it increases the administrative burden, but then we don't get reimbursed, appropriately. And 1 in every 5 Americans get their health care through Medicaid. 70% of all nursing home residents rely on Medicaid. So we already talked about the fact that we want to be reimbursed for coverage, and we want reimbursement rates that are appropriate. We talked about this, so I think I just have it double in the slide. Let's move on to telepractice, because telepractice is also one of those health care issues. There are many rural areas where they don't have SLPs or audiologists. There's a shortage of SLPs and audiologists in these rural areas to deliver services. So we want to advocate for the recognition and coverage of services delivered through telepractice. These telepractice services need to be just as good as services that are provided on site with the person right there sitting across the table from you. But we also need appropriate standards for a person to have a license to do this. We also want Medicare and Medicaid to cover appropriate services delivered through telepractice. We want to advocate for funding for federal and state legislation and regulation to provide for private health care plans so that people who are on private health care plans can receive services through telepractices, and we can be reimbursed. And we want to protect the consumer. So we also need licensure, limited licensure, but we need licensure to make sure that we can protect the consumer. That's one issue. Then you need to actually demonstrate the value and quality of your services. You as members need to be able to demonstrate that, because payers for the services are requiring that you show that your service is valuable and that you have used evidence-based interventions and that the outcomes are quality, the person is making progress. So you're your best advocate. You need to demonstrate the value of your services. ASHA is going to coordinate advocacy strategies with healthcare and school-based payers. They'll utilize data to support advocacy efforts related to adequate reimbursement across payers. They'll work with state association leaders to effectively demonstrate the value of our services. And our services are valuable for achieving desired client outcomes. They'll take a leading role in establishing policies that define quality and desired outcomes for our services. Scope of practice is something that we worry about. Increasingly, other people are stepping into our scope of practice. Okay? So we want our scope of practice to be clearly defined, and we don't want other people to be able to do that. Okay, and so that being said, like hearing aid dispensers have stepped into the scope of practice for audiologists, music therapists already also operate under the same scope as audiologists and SLPs. So we want a narrow definition of what our scope is, and others not to be able to step into our scope. And you can do that by making sure that The Certificate of Clinical Competence is the highest recognition that someone can have based on the things that we do. So we want to advocate for policies that require use of the highest qualified provider. We want to let consumers and payers know about our value and our expertise. We want to oppose any kind of practice acts or licensure efforts that would expand our scope of practice to other professionals. And we want to engage and inform other professional organizations about our unique training, our expertise, our value. Okay? And then at the state level, we're looking at a comprehensive licensure law. Now, this is a universal licensure law because, like, if I'm in Tennessee, I have to get licensed in Tennessee. If I'm in South Carolina, I have to get licensed in South Carolina. If I go to North Carolina, I have to get licensed in North Carolina. Now, many of these states have reciprocity, so I don't have to retake the test. But what we say is that that's like cumbersome. Why can't we just have this national certification that's recognized across all geographic areas? So regardless of where I go, I have this license. And I don't have to get re-licensed in this state or hold a license in this state. So that's what we're talking about when we talk about comprehensive universal licensure. And I think it's a barrier. When I came to Tennessee, I said, you know what? I'm not even practicing, so I'm not going to get a Tennessee license. And I don't need one because I'm not clinical. But if I decide to become clinical, I can't practice without one. But there are some states who have decided to go to comprehensive or single licensure. And so ASHA supports comprehensive licensure that's recognized by state credentialing agencies and ensures maintenance of existing benefits for each profession. So right now, 16 states have comprehensive licensure. I'm not sure which states those are. I tried to look that up, but I couldn't find it. But I think I'd have to go back and look because somebody just got it passed. But that just cuts down on everything in terms of your ability to move across the U.S. and practice. Okay. One thing is for sure, the ASHA-Cs are recognized nationally, and so most state licensure agencies use that as a hallmark, as a gold standard. Okay, we're almost done. Audiology and SLP assistants are being used within the service continuum because of the shortage of SLPs and audiologists that we have. So states are opting to use slippers, SLPAs. And that being said, I think even in Clarksville, I was talking to some of the students, Clarksville wants to hire speech teachers instead of SLPs. Why? Because it's cheaper. Okay, and so we want to make sure that there is a license, that slippers and all of the different types of assistance we have on the continuum are using. We want the education, the training, and the supervision to be uniform. Okay, hold on for a minute, guys. This is my husband, and we're traveling tonight, so hold on. Okay, let me see. Sophia, you said something I plan to ask my supervisor. Excuse me. Which part of our practice are we not willing to pass on to other practitioners? I know that's right. That's right. OTs, they do work on feeding. I don't think it's okay. I think it's within our scope, but they say it's within their scope. So what we have to do is work collaboratively and figure out, well, what part do you do and what part do we do? Okay. But even this thing, so that goes with making sure that, you know, people aren't working in our scope. But we do need assistance because of the shortage. And so we have slippers and people like that who are speech teachers who do come in and help us. But they need to have some type of uniform standard in terms of their education, their training, and even in terms of our ability to supervise them, because we are interested in quality services being delivered to persons who have communication disorders. And so there needs to also be some kind of way for us to assess their basic competencies. Just like as a speech-language pathologist, you have to take the praxis. You just did a comprehensive exam. But what do SLTs and SLPAs do in terms of their competence, in terms at the state level? So this is what we're looking at the state level. And in 13 and 14, several states adopted rules governing the practice of SLPAs and others. So this was Alabama, New Hampshire, and Montana. And these states are considering adding licensure requirements based on ASHA's model. Okay, and so we got a model. Everybody has to go out and do a CFY. You got to make sure you have all of your clinical clock hours and your academic requirements. You have to take a national board exam. So we're looking kind of like for some kind of model. And then the last issue, guys, and then we'll end class because I have to travel. And it's 6:40 now. But this is the last issue. These are things that you are going to be concerned with when you get out. This is more at a state level, but many of the state departments of education personnel or divisions used to hire us as consultants, and they still do, but they've cut back on the number of SLP consultants that they use because it's a budget constraint. And so we still want to collaborate with state associations and organizations to make sure that they know what we do and that we have some input into policies that they're putting in place. So we still want to be hired as consultants to the Department of Education. So ASHA will promote the retention of qualified audiologists and SLPs who are currently serving as consultants. And then ASHA will also provide Department of Education with information about the importance of our services, both audiological and speech-language pathology services. Does anybody have any questions about some of the things that you're going to be confronted with? These are the basic issues that we are concerned with for 2017, but in 2018, they won't keep some of these same issues, and then they may add more issues. Okay, and so you always have to be abreast of what's going on in your profession. What you can do is go to the ASHA website and look under the tab that says Advocacy, and all of these issues are outlined under that tab. You will have an assignment on this, and I'm going to give you the assignment, but I'll do it next week. I'm going to ask you to take an issue in education, in healthcare, and in a professional issue, and then you'll answer various questions about those issues. And this will go into your professional area of your portfolio. Okay? And how many of you have taken the praxis? Tell me again. If you've taken the praxis, raise your hand. 1, 2, 3, 4, 5, 6. Anybody else taking it that has not raised their hand? Okay, 7, 8. So right now, 8. So the rest of you, when are you taking the praxis? Will you be taking it before you graduate? July the 22nd. Okay, July the 11th. Oh, so you're getting ready to took it, okay. Before graduation, okay. All right, so we'll talk about praxis in the next class. However, what I wanted to say about talking about praxis is because you guys have already taken the praxis, some of you, then I will make that class interactive because we want to know about your experience and what advice you can give. Okay, now, I won't do this class until the 13th, but somebody will have taken it on the 11th. So any tips that you can give would be helpful, okay? And then we're going to go on to job interviews, and then we'll talk about licensure. Does anybody have any questions before I end this class?
I do, Dr. Smith.
Okay, go ahead.
Okay, this is Ashley Ramey. So for the grant, I heard you say 2 years. I thought it was 4 years to pay back the grant if that we took.
It's 2 years for every, if I said that, I meant 4, but it depends on when you receive funding. So it's 2 years for every 27 semester hours of funding. So yeah, it's 4.
4, okay, just check. Thank you.
Okay, and if I paid for prerequisites, then it extends a little over 4. Yeah. Okay.
Okay. Thanks.
All right. Anybody else? Okay, hearing no other questions. Guys, have a wonderful night and a good week and a great weekend. And I'll talk to you next week. Or before if you need to talk to me. Yes, Nicole, you can talk to me. Good night, everybody. Nicole, do you want to stay on, or are you going to call me?
It doesn't matter. I can just stay on.
Okay. Sounds good.
I know my supervisor had emailed you about hours.
I think I answered 2 of her emails, I believe. She asked about a second practicum site. I have to talk to Ms. Hunter about that. Because it seems like you had visitors into your site. Is that correct?
Yeah, the Joint Commission was there, and so we just got a really late start because they didn't allow students on the floor. I can only be there 3 days a week because the other 2 days she has a student from UT.
Okay.
And we calculated out the amount of hours I need, and it's just impossible to get them only going 3 days a week.
Yeah, I think I forwarded your email, so I'll talk to Kathleen and Ms. Hunter on Monday. We'll see what we can do to see if we can place you somewhere else on the other days.
Okay. All right. Thank you.
You're welcome. Okay, have a great night, guys.